Let me say welcome back and good morning, because some of you might be saying, wait, I didn't know where you were the first half hour. Well, hopefully you were already on with us. Love that we finally had a chance to do that interview with Russell Butler, the dancing UPS man. If you didn't see it, go back and watch it after this show. But we told you we had two powerful shows today, and one of those is with our doctor. Normally you see her on Mondays, but she's just as busy as a lot of the parents taking kids back to school. So let's bring her on, Dr. Sara Jensen with Regional Dermatology. Good to see you, by the way.
You too. Thank you.
And your kids just went back to school, is that right?
Well, they didn't go back to school. We went to Lollapalooza in
Oh,
Chicago.
wait a minute. You had fun?
So there was the last kind of hurrah before we take them off to college.
That
so
makes sense.
Then a few weeks we'll be heading out.
Okay, because I was saying school's starting in about a week or 2 weeks for everybody. All right, you get a break for that.
Yeah.
You also brought one of your patients in. This is Demetra Begus.
Yes.
Demetra, nice to have you. I heard an accent when you came in. Where are you from?
Originally from Greece,
Oh, beautiful. What area of Greece?
Peloponneso.
Yeah, sure, I know that. No, but I have a lot of people. I have a very dear friend who is Greek, and they're actually getting ready to go, I think, in just a month or so. So if she's watching, she'll say, my heritage.
Yeah.
Well, beautiful. You're a beautiful woman. We're going to talk about something today that I know is a big struggle for men and women, but especially for women. So this is going to be something that I would love for you to interact whenever we have Dr. Jensen on. It's a lot of questions and comments. If you or someone that you know is dealing with thinning and loss of hair. Now, we've mentioned before, Dr. Jensen, that it's become accepted for men. Not that men like it. They start to have thinning hair. They look at, is it true, their mother's, dad's, or brother's side of the family? Is this a real thing, or is it
Actually, I
not?
was reading up on it, and actually can come from either side of the family. Yeah, the maternal or paternal. So yeah, it's hard to know. But they do expect to lose hair, and they're kind of surprised or happy when they don't.
Right.
So it's
Not that they want to, right? I think a lot of that, and we're going to do the shame book today. I can just feel it today. So 100 Days to Freedom for Shame comes up at the end of the show. But guys start to have their hair thinning. Women, though, it's not in society expected. And when it would happen, there's so many things that people go through in their minds of, well, why is that happening? Are they
Right.
going through cancer treatments, right? All these different things. So we're going to talk about that, but what exists for them. So let's tell your story first, Demetra. So what started happening with you and how long ago?
Oh, I think it's probably, I would say my hair loss, I would say a good over 10, 12 years.
And how did it start?
I was just kind of noticing more, of course, when you're showering and how much hair you're seeing. And then just after that, you would just touch it with your hair, and it would just, you'd see coming out and not slowing down. So then after that, I started, I have a thyroid problem. So, but my medication is right on, so that wasn't the issue. Stress, you think about that as well. So I was paying attention to all of that. And then I said, okay, then start getting a little bit worse. I said, stop coloring my hair. And that's what got me to stop coloring my hair. I said, well, maybe the chemicals, though it says it's not supposed to, but I said, well, let's give that a try.
Sure.
And that's what started with it. But I noticed it still kept happening, and I think they lost about, I would say, 5 years. It started to get worse and worse. So I saw Dr. Reed. That was about maybe 3 years ago. And he got me, I forgot the name of the medication. I was telling Dr. Jensen that. And it seemed to slow it down. But it seems like my body got used to it. Then it just
Started up again?
started up again. So Dr. Reed recommended me to Dr. Jensen after that. And she started me on this program. It was very depressing.
Well, then we might do
Okay.
depression today. We might do them both, right? I would imagine so. As we had mentioned, men, they're like, ugh, and they throw a ball cap on. Or they start embracing it, and they're like, I look good bald. But women, that's just not something that we know. You just mentioned that Dr. Jensen put you on a program. What was the program? And by the way, what is it that you would medically categorize that she's had?
She has a not as common of a hair loss. It's called lichen planopilaris. We call it LPP for short, much easier. But it's actually where you get inflammation at the hair follicle down deep. And sometimes you can tell from just the clinical exam, but sometimes you have to do a skin biopsy of the scalp. And so she really needed an oral medication to help reduce her inflammation in the skin.
And you're looking at some pictures on the screen right now.
Right.
So the beginning warning signs would be something that looks similar to this?
Right,
Okay.
and it's like these kind of tiny little hairs at the front of your hairline, and they have this kind of like a rosy appearance at the base.
I was going to say, it looks
Yeah.
like it's like inflamed, or
Right,
it looks like someone's
exactly.
thinking they have a rash or something.
Right, and it's a scarring type of hair loss, so you really want to address that early, because if you don't get to the inflammation, you can lose those hair follicles, because those are at risk of being, lost.
So, I was just going to say, so let's ask this. So if someone starts to see that and they see a pattern of that, if they come to you and they start a program or medication, are those follicles able to be regrown?
If you can get to them early on,
Okay.
and reduce that inflammation.
Otherwise, if you let that go, then no.
Yeah, you start to lose it, and it is a progressive, disease. So,
So
we
is
try to
it-
slow the progression. Sometimes it can kind of come on and then and burn out, and it's over. But the medicines we use are so simple. The Plaquenil or hydroxychloroquine is a very benign drug. We have to do a little blood work, some eye exams yearly, but overall, it's one of the medicines rheumatologists use a lot for for arthritis and other conditions.
Are there any side effects? Is there anything, if someone starts on that they would say, this doesn't sit well with my body?
Some people do have reactions to the medicine, although it's like a drug
Minimal?
reaction. Yeah, very rare. The lab work typically comes back normal. The eye issues, I really have not seen any patients who have eye issues with this medicine.
Good. And
Yeah.
you've had no issues?
No issues with the medicines.
Good. And so is that how yours started? Did you start seeing something like that?
A lot of thinning up here, mostly on the hairline, and I could see it. I can see my scalp so much.
Yeah.
And there was times like I would do this, and they just kept coming out. It was I thought it was just.
So let me ask you this. Again, if you're just tuning in, Demetra Begus is a patient of Dr. Sara Jensen from Regional Dermatology. So as that would happen, and I can just imagine the emotions that you must have gone through. You mentioned depression. I'm sure, were there a lot of very tearful days?
Yes, they are. But I'm a little bit of a tough cookie. I know emotionally. I said, okay, it's happening. I don't like it. Then I kept researching, what are we going to do? So, like you go from trying this, trying that, and I'm the kind of person that says, I'm going to just keep trying to see where we can
Sure.
do it.
And looking at you, as Dr. Jensen said, you would never ever guess. Your hair's beautiful, and that's another hard thing for women is to say, all right, I'm not going to color my hair anymore. I'm going to go ahead and start to go gray. Was that hard for you, that transition?
Mentally, because I wanted the hair loss to see if it would have.
Sure.
Going through almost the first 6 months of changing the color, that was a little bit, but I had, I mentally said I was okay with it. And then after a little while, I said, oh, okay, I was starting to embrace my gray hair.
Well, you're a beautiful woman. I mean, it looks
So-
good. What color was your hair before you started?
Originally, I'm black.
Black. Okay. Yeah. And so again, it's that transition period, and then it's the acceptance of it. But knowing that you would be able to do something with Dr. Jensen's help to take care of the thinning is, and the loss of the hair is obviously the main thing. So when they start on that, how long are they on that?
Really, we stay on it until a patient may decide maybe they want to take a break from it, take a holiday. And I tell them sometimes we're treating something that may be under control. So we can take a break for a month or 2 or 4 and see how they're doing. And I have had patients go off of it and then also come back on it. So you just never know.
Or so is she on the program right now still?
She's
You are.
still on the medicine. We talked about another medicine called minoxidil, which I think we brought up before on one of your shows, that a lot of doctors have come back in favor of writing just for hair thinning in general, whether there's inflammation or not. Now, she hasn't started that because we talked about one of the side effects can be excess hair, on
your
the
face?
face, your mustache, that can bring all that back.
No thanks.
No thanks. And being European, the genes, I have more of that. And
Right.
I told Dr. Jensen, I just cannot do it.
No.
Right.
If we can just keep it slowly. I think the medicine, you said the 2 medicines I'm on, all we're doing is slowing the
We're
process
slowing-
down. So
yes.
I will be slowly losing, but all we're doing is
Slowing
instead of
that
moving,
down.
just
Yeah.
slowing the process.
Yes. Yes. So there's a lot of questions that people have. I am going to take a quick break. We're talking again about hair loss, but it may affect women. It may affect men. I'd like to know how early it could possibly happen for young girls thinking, oh my gosh, am I going through this? I knew a person that I worked with in the news business who had alopecia, and that was very stressful, depressing for her. All those things. If you have any questions or if you have any comments, feel free to drop them in to the post and let people know, because they may have seen our other feed end, that we are on again. So give them a call, text them, let them know that we are on my business Facebook page as well as my YouTube page right now. Regional Dermatology is where you can find Dr. Sara Jensen. Again, 2 locations, one in the Festus area and one in Chesterfield. There's the website, by the way, regionaldermatology.com, and the phone numbers to make your appointments. And I love the people that have gone into her already. They've all sung your praises. We'll have more with Dr. Jensen and Demetra Begus when we return. Everyone knows about Jody's balls, and why is that?
I have the best ball. Oh my God.
Oh, wait. Well, you know, this is the last day in a while that we'll be talking about the crazy hot temperatures. If you didn't see at the beginning of my other show, 97 for the high today, but it's going to feel like 105, and you're going to want to jump into something that looks just like that. Is that in your backyard? If so, are you doing your due diligence to make sure that it looks that beautiful and clean? 10% off of chemicals right now at Just Pools, the pool and spa specialist on the West Outer Road in Arnold. If you don't have one of those, but you have thought about it for a while, I ask you to pull the trigger, but only with our friends who support our show. Just Pools, again, they can not only put that beautiful pool in for you, but create that gorgeous backyard oasis that you've been looking for, so that you can throw party after party or just a nice little get together with a few friends. I'm telling you, it will be life-changing. Just Pools, pool and spa specialist. Here's their address, 3987 West Outer Road South in Arnold, and the phone number is 636-464-7110. All right, welcome back. Again, we're doing our Ask the Doctor segment on Tuesday with Dr. Sara Jensen. She's with Regional Dermatology. Welcome back to a lot of you. I want you to hear about this, and if any of you have gone through this, again, the more real you can be, the more open and raw, it's going to help everyone else. It's not taboo to talk about this. In fact, the emotions that you go through, someone else is saying, yes, I've been through the same thing. So as Demetra tells her story, you might say, that's what I've been going through. And I'm so glad to hear that there's something I can do about it. So Dr. Sara Jensen with Regional Dermatology and Demetra Begus telling their story. I mentioned going into the break, Dr. Jensen, that I have a friend, again, doesn't matter who it is, but she worked in the news industry here in St. Louis for a long, long time. She did come out and talk about it, but if you weren't there, it's not my place to say who she is, because you might be sitting there wondering who it is. It doesn't matter. But she had a wig that was beautiful. You would have never known, but she took it. It was so impactful and powerful. She took it off, and she said, this is what I've been going through. So she went on a little bit of a sabbatical. She was dealing with a lot of anxiety and depression. She was going through alopecia. For people who don't know what that is, can you explain what alopecia is?
Alopecia is hair loss, so that's kind of the broad umbrella, but she may have had alopecia areata, it sounds like.
I think so.
Where just the smooth,
Yes.
bald, yes. And that can be very disabling for patients. You can have just small little like round coin-like areas on the scalp. You can have a complete loss of eyebrows, eyelashes, even body hair. That's universalis. So it can come on for any reason at any age, and it can be very disturbing for patients.
What causes it?
It's autoimmune. We really don't know what causes the body to react to its own self like that. But then you can check things like thyroid disease that can go hand in hand with it. But it's very common, and patients can wax and wane. Sometimes they regrow the hair, sometimes they don't.
And so Demetra was telling her story before we went to the break. So as far as an age, because there are probably people that maybe have mothers or grandmothers or aunts, et cetera, and if they see this happen, they may start thinking, is this coming my way? Is it a genetic thing that someone that's younger as they're growing up feels might be coming, like anybody that's in her family?
There's different types of hair loss. Like LPP necessarily isn't necessarily genetic,
Okay.
but the female pattern or androgenetic hair loss, that is genetic, and that can run in the family. But it's hard to kind of parcel out who you may have gotten it from. It's not as easy, to define. So that the androgenetic alopecia, you can have like two eras of your life where it might show up, usually 18, 20, 22 years of age. And then also about menopausal, probably even the 40s to 50s to 60s years of age. So there's two peaks. It's really disturbing when you see someone younger, 18, 19, 20, who's already showing those signs. The earlier you get to those patients, the better. And you can do either topical medicines or oral pills. It just depends,
So did you lean on family, friends when you were going through this? Was there a lot of discussion, or did you just kind of leave it to, I don't want to talk about this, hopefully no one's paying attention to this?
No, I definitely, my husband, my sisters, quite a bit. They helped me to kind of not get so down depressed and just keep working at the issue. Something about hair loss. So my son started to lose his hair at age 18, that you were saying. So that mentally also bothers me. So now I know, and that was very, very hard for a young man. Sure. I watched my son go through that, and it bothered me for him and mostly. When I went to Greece 2 years ago, I have two cousins from my mom's side that they got married and they had children. Both their sons, just like my son, so there is a gene pattern. When I went, lost their hair early, just like my son.
Right.
So, and kind of then one way I said, okay, definitely there's a gene in the family that runs with that, because now they're in Greece totally eating differently than we are here. For a little while, it was certain food I was feeding my son. As a mom, you kind of think, did I do something wrong for him? And so that kind of gave me a little piece that was in the situation. Now he's older, in his 30s, and like you said, man started to a little bit now. It's okay in my 30s now, but when he was in teens, 20s, that was very, very
absolutely.
hard
You think
on
of
him.
coming into high school, coming out of high school, going into college. I look at my brothers, because they both have thinned out. But you look back and you're like, oh my gosh, they had such thick hair.
Right.
My father, and you can see in that picture, he was blessed.
Yes.
I mean, he always had the dark hair for a long, long time, never did lose his hair. And, you've got sons who are like, that's not fair. How many times have you heard the words, it's not fair?
Right.
So if you didn't hear her say at the very beginning of the show, although we've all been taught, look at your mom's side of the family, you said it can come from either, though.
Yeah, either side,
Is it lean towards me?
I don't think we can really,
Interesting.
But I was going to say, I have a lot of patients who come in, a lot of women who say, when they talk to their doctors, like, oh, look at Demetra, she's got gorgeous hair, right?
Yeah.
And so a lot of people would dismiss her, saying, well, you've still got great hair, right?
Exactly, and that helps misdiagnose me, where maybe I could have started younger age.
And you have to reassure a patient, like, I understand where you're coming from, and while you may have thicker hair than I do, she, knew her hair to be so much thicker when she was younger. So it's you have to respect that. I have a lot of patients come in tearful just for that reason.
Well, because they know we might be looking at it, but it's your first time you're ever meeting them, and you're thinking, well, it's fine. Yeah, but this is not what I'm used to.
Yeah.
So you brought something up which we talked about last week: menopause, perimenopause, postmenopause. As women get into those years, is it just a natural that hair is starting to thin no matter who?
It can, yes, after menopause, and it's called senescent hair loss, so it's over time, yes. But you can still address it. I mean, I myself experienced it when I went through menopause, and so I'm on minoxidil. I have to deal with the mustache coming back and all those, side effects. But we take the good with the bad, and
Yes.
so it has been helpful.
So you talked earlier, Demetra, about and this is my question, about a food standpoint, nutrition standpoint, vitamins. Are there certain essential things that we should be doing to help with this?
Yeah, we check vitamin D levels because those can be low. Where a lot of us are indoors, not getting the outdoor activity from the sunshine that can, help us with vitamin D. We check a ferritin, which is your stored iron. And then we check a thyroid as well. So beefing up on foods that are high in vitamin D and high in iron, or supplementing them if we're not getting that in our diet.
I know in the past shows we've talked about the difference of here in the United States, or you're talking about being from Greece. In other countries, if there's not so much processed foods, have we seen, if we can, I don't know if you know this or not, but if we could look back maybe 10, 20, 30, 40, 50 years ago, has this changed at all because of what we have in our food?
Well, that's a good question. Excuse me. We have seen more LPP in our patients and in younger patients, and it's really disturbing. I mean, we see them in 30s and 40 years of age, where normally we'd see them in 50s and 60s years of age. And so we really don't know where it's coming from, whether it's our diet or exposures. Some people have postulated, a lot of the creams and sunblocks we use are made with like nanoparticles so that you don't see them. They don't go on white and pasty when you're using your sunblock. Some people, and women in general, tend to use more products on our face
Absolutely.
and hair. And, so it's postulated it's maybe something in our exposure, our environment, but really nobody knows yet.
Well, I was just going to ask because, yes, we are putting more and more and more. And here's the problem that I have, that we have such a trusting society. You would hope that we could trust the government and the FDA of what's being put into products or vitamins and supplements and things that we use, but there's a lot that is allowed through, or there are things that people want to take that are not FDA approved.
Right.
They just want to try. They're trusting, or they're tired and they're up late at night. They see something on TV. Oh, I'm going to buy that. They don't even know what's in it. But that would be my question. We use so many products on our hair. I'm going to raise my hand and say it. Well, whether it's volume booster, because I want my hair to be a little bit thicker, and then we're putting these pomades and creams and. Are we creating a problem?
I mean, there's got to be something to it, I would think. But really, there's not enough studies. There's also not enough studies in women, and also in conditions that are not as common. It's not like heart disease in men.
Right.
We have those big trials, but in these smaller, or less common conditions, we just don't have the data.
Demetra mentioned earlier about coloring our hair. So is that doing damaging things?
I do worry a little bit with female pattern, male pattern hair loss. I don't worry so much about coloring the hair.
Okay.
But when you have inflammation in the scalp, anything that might just tamper with that, I tell them to kind of lay low. Try to avoid the hairstyling products and the coloring if they can. Until we get them under control at least.
And again, we want to stress both women and men as you're watching this show today. So for treatment aspect, if someone is starting to thin and they want to have some options, what can you do at your office to start helping them back through that?
Well, an easy thing to do, even before you hit the office, is just over-the-counter minoxidil, Rogaine. That's an easy
work.
topical. Yes, that can work.
Okay.
Yeah, definitely. There's 2% for women, but we go up to 5%, which is the men's strength, but we use it for women as well.
And that's over the counter?
Right, that's over the counter. And now we in our office, we kind of soup it up and we do a higher concentration. We add a few things to make it more, to absorb better in the scalp. And then we may start the oral pill. We do minoxidil, but we also will add a medicine called spironolactone because minoxidil can cause you to kind of fluid retain. So the spironolactone helps you with that, so that you don't retain as much fluid. And also that can help with hair loss as well.
So again, if you are wanting to, and I would think you would, want someone who on a professional level can take care of you instead of just buying something and hoping it's working at your counter drugstore, to go in and get the souped up, the steroid version from Dr. Jensen with Regional Dermatology. Michelle asked what can be done for the loss of eyebrows or thinning eyebrows, or they suddenly, did you have that problem?
Yeah, mine did. And microblading.
Yes.
Yes.
Microblading is one way. Yeah.
Is what I've had no choice because I have lost my eyebrows
Right.
because of that
But
as well.
you can
And so you
use,
did microblading?
And she looks good. They look great.
They do. I would have never known. I would have to get closer to you. But see, a lot of times there's all these different treatments that people have out there. And I'm like, is it going to look natural? Is it going to look unnatural? Yeah, yours look beautiful.
And it's not because I want to do it, but there was no eyebrows and
At all? Or
well,
just
I have
almost
very,
non-existent?
yeah. There's a few hairs, and they're there. Whatever's there is there, And then I was seeing customers that I work, and I asked, and they suggested try it. So I did, and I'm glad because it really helps to show who I really am.
So look right here for me for a second. Look at her eyebrows. Look how great they look. So microblading, can you explain what that is, Dr. Jensen?
Well, from what I understand, it's usually done, I think, in an esthetician office, but they basically, it's almost like not a permanent tattoo, right?
Yes.
It's like, and this one is done instead of it's like they draw a little like a hair.
Right.
So you're looking from far away, it looks like there's actually a hair on it.
Right.
So it's like tattooing.
It is.
It's
Yes,
called
exactly.
microblading.
But the thing is, and that's what I've seen, people have it done, but sometimes it depends on, this is why you have to know where you're going and who you trust. Some people have had it done, it's so blue looking. And does it start that way?
I've
that ever
seen
happen to you?
women. No.
Good. So you had someone who knew what they were doing.
Yeah, I've asked enough questions, and I'm in an industry where I see a lot of women, and I see the ones, and when I say, oh, wow, really, and where did you go and get it? And that's how I went.
That's the best way, by the way, is to
So they are-
yes,
right?
yes, right, and that's the trusting aspect.
But I never would have done this if I have hair.
Right.
I
Correct.
just lost my hair.
Right.
So that kind of solved that issue. And Dr. Jensen is helping to slow down. But there will be, as time progresses, I will be losing more and more of my hair, which is sad. And hopefully we could get a little bit more research done.
Right.
So not just for all the women out there.
Right.
So when people compliment me and say, your hair looks nice,
Right.
I actually feel really sad.
Why?
Because they emphasize, they see my hair and it's a part of you.
Yep.
And I say, oh, one day it'll be gone. And it does, it makes me feel sad.
Is that a guarantee that it will be?
Well, the hairs that are lost, but we're trying to slow the progression, and it is possible that her condition may burn out and just may have
Let's
lasted a few
manifest
years.
it.
Yeah.
Right?
Let's say you're going to
Yes.
have this beautiful hair
Right.
forever.
But I would like to see research done, not from me, for
Yes.
Right.
all
Yes.
the
Right.
women and even
Sure.
men, that I know, look how far we've come with the medicines now compared to 20 years ago. So hopefully
Absolutely.
a little bit more research done that we can help all the women out there.
Yep.
And women, if you start seeing hair loss at the beginning, don't wait too long.
Absolutely. Yes, and that's the
Just,
biggest thing
this
that we
is
can stress. Don't let it go.
know.
Get in. I would love for you to contact Dr. Jensen. She'll be able to work with the team with you to say, okay, great, we caught this early. Let's start taking care of this. Let's get you on a program just like we did with Demetra. You're looking at some of the pictures that we showed you earlier. Again, you said it's LPP,
Right.
but there are so many different aspects. What about for men? Okay, so if men are starting to see their hair thin, there's all these either tried. They might see on TV or whatever. They're looking at all these stages of what they've gone
Right.
through. And they're wondering, is there something that we can do to stop it? Can I start to regrow my hair? Is it actually their own follicles and regrowing their own hair instead of
yeah,
having
they
to
can.
have
Sure.
these surgeries and things done?
Yeah, they can. And they can use the same medicines, the minoxidil. They don't use spironolactone, but we can use minoxidil with them. Men have a few other options as well. They can use Propecia or what's called finasteride, which is usually used for prostate enlargement, but we found that it also can regrow or maintain hair. And then they can also use the topical medicines. We do another procedure in the office called PRP, platelet-rich plasma, and people use it for joints
Right.
and other issues.
That's used for hair also?
Yeah, you can
Oh,
draw the blood,
fascinating.
spin it down, and re-inject it into the scalp, and it's very safe because you're not taking anything but your own, serum.
Your own, wow.
Right.
Yeah, we've had a sports medicine doctor on in the past, and we've talked about PRP injections for knees, etc. I did not. Breaking news to us. She's like, nope, but we know that in the medical field. Somebody just said, what is the difference with FFA, frontal fibrosing alopecia?
Alopecia, yeah. So you could be a lumper or a splitter. But the frontal fibrosing, sometimes people have little tiny bumps that develop on the forehead. They can have loss of the brow as well, and then the frontal hairline as well. So it can kind of overlap a bit, but it's just kind of a distinction of the same type of hair loss, with this frontal hair loss of brows. Yeah, but they both typically happen more commonly in women.
Yeah.
Okay, and so no, Zach, you do not use a Sharpie for your eyebrows. He's in the other room. He's like, do you use a Sharpie?
Yeah.
No, you do not.
Yeah.
Don't try to do things on your own. You mentioned thyroid earlier, by the way. My mom growing up, she always had her eyebrows were shorter, so she would draw them on. She ended up having the tattooing done for the makeup tattooing. And what I asked earlier is that at some point, I think you have to have it redone because it starts looking bluish, which is what she had gone through.
Right.
But here's a funny story for you. Only because it's all I knew of my mother, I wanted to be like my mom in every way. I shaved my eyebrows to be that short, and it was right before, I knew I'd make you laugh, right before school pictures.
Oh, yeah.
So we look back at those, and I'm like, oh, look, that's when I did it. Where I was want to be like mom. My mom's like, I don't want my eyebrows to be
Right.
like this, honey.
Right.
I'm like, I didn't know.
Yeah.
I did that to myself. Okay, so again, everybody, we're going to take a quick break. If you have any other questions, or you can always do a hashtag replay for us, maybe you had to run off to work, and if you have any questions about this for yourself, for your kids, for your husband, for your wife, etc., there are things that can be done. We'll talk a little bit about the emotional aspect, the roller coaster that you go through when you first realize, hey, this is happening. But I do want you to have hope that maybe that long term, maybe everything will be good for you.
Right.
Any questions you have, drop them in right now. Ask the doctor, Dr. Sara Jensen with Regional Dermatology. We'll have more when we return.
Come on, Monica. Let's go, St. Louis. Turn and burn.
Hello, Miss Monica.
Monica.
This is a good one. Sometimes you spend like 10 years and you don't got one like this.
Monica.
It's a feast. It's like a 17-course meal. You just like, you need a minute. With wine, with a wine pairing and a whiskey pairing.
That is what? There it is.
I think I just have the most beautiful experience. I saw fireworks.
Thank you, Monica, for making our day.
Welcome back. It is 10 after 8. And whenever you sign on to our show, let us know where you're watching from, because as we have all of these incredible guests in our chair over the last year and a half, it just spreads and spreads and spreads like the branches of a newborn tree, and then all of these little branches come. It's just what we want you to do. Share these shows with your family and with your friends so that we grow outside of our immediate, what we call the direct market area, Missouri, Illinois, our surrounding areas. People go on vacation and then they say, hey, I love this show. It's spreading positivity. You should be watching this show. If, by the way, any of you would like a flyer that we have made up that shows people where they can get hope and positivity and light, we can send those to you. You can print them out and you can take them with you, drop them off at your office. Keep spreading the word that we're here. And I'd love to know what kind of topics and guests you would like us to have on. We're visiting with Dr. Sara Jensen with Regional Dermatology and one of her patients, Demetra Begus. We were talking about Greece, but you also said you have family in Canada? Mm-hmm. All right, get them all watching. I just want to see. We'll start seeing people pop up. You just mentioned that you feel like your husband's going to start watching the show more?
Yes,
Good.
definitely.
Good. I appreciate that. So let's talk about the emotional side of this. You mentioned it a little bit, but what goes through your mind? Do you have in the back of your head that this is what's coming for me, and do you stress about that?
Yeah, it's really hard to explain. I know it's gonna come in the future, and I'm saying, oh my gosh, what am I gonna look like? You know, choosing the wigs, the hotness, the uncomfortable of the wigs, and I see a lot of elderly women in my business, you know, that pulling more of the hair backwards, forwards, doing things to it to try, and I kind of see all that, and I'm saying, okay, one day I'm gonna have to deal with that. A hair extension is a new thing I'm learning that a lot of ladies get. In one way, those kind okay, you know, if it's so bad, kind of gives you a little bit of hope. Mm-hmm. We can do the hair extension. We can take more hair from backwards and move it forwards. We can do the wigs, you know. So I'm saying, okay, you don't know what's going to happen. You're doing your best that you're doing. I'm hopefully new knowledge, new medicines can come up to help, not just me, I'm talking over all the other women, because I see it in my industry where I work, and I see them affecting them, and I feel for them because I know what they're going through, because what I'm going through.
Sure.
But in return, I'm trying not to let it control my life.
Good.
I'm trying to think positive. There's so many other worse things that can happen. Sure. I know this is not the end of the world. I know our hair is who it makes they are, but you got to move forward. I know I'm emotional saying that, but that's what I use inside me to help me not get so down.
Sure.
The days I'm down, okay, come on. Give myself a little kick and say, okay.
Well, give yourself some grace, Demetra.
Yeah.
Also, don't dismiss your emotions. They're real. So
They
someone
are.
can't say what I'm going through is worse than what you're going through because you're feeling it. I always say, yes, I mentioned earlier, we could walk the halls of St. Jude and look at what the kids are going through, and then we'll say, oh, suck it up. Mine's not as hard. But you're still feeling an emotion. So their emotion, your emotion, everybody's emotion, whatever you're going through, it's a real thing.
is.
But yes, we can try to choose positivity, have hope. Again, it's my hope that, as we said, maybe that's not what's in your future. Every day that we are blessed to be here on earth is just to stay in the moment. So right now you're beautiful. Your hair looks
Thank you.
incredible. You are right now putting your story out there, and we thank you for that because you can be a role model and an inspiration for a lot of other people. When they come to you, Dr. Jensen, do you help them on the emotional, spiritual side of it?
Oh, yeah.
Definitely. I hope so. I also try to link, it's not a very common condition, so patients really don't have anyone to talk about it. And we have just a short visit to talk and kind of reassure. But I have a couple of patients that will let me give out their number to people like Demetra just to contact them and say, hey, this is how I went through it. I understand. And, and it gives them a sense of like, oh, there's a community out there that understands what I'm going through. Because especially these not as common conditions, they don't really have anyone to talk to about it.
So for all, again, young boys, young girls, men, women, what are the greatest things that you would say to be watching for and to not dismiss for anything? I mean, we've been talking about a lot of different aspects. We mentioned she had LPP. There's treatments. Again, we talked about potent and super potent topical steroids, second line treatments, monitoring it though. So if you can tell everybody, although that we showed some pictures, but like male pattern baldness, different patches, thinning, hairline, what would you say are the most important things to be looking for? And then is it an immediate thing to make an appointment?
I think, the excess hair in the shower, that's one thing that we hear about most commonly. But also to know that, everyone can get hair shedding after like 3 to 6 months after a traumatic event. Like COVID, we saw a lot of hair shedding.
Yes.
If you have pregnancy after delivery, 3 to 4 months afterwards. If you've had surgery, if you've gone under general anesthesia. So that's a reassuring visit because you can say, well, that hair was going to shed anyways. It just shed all at the same time because you had this trauma to the body or to the mind. So that's a very reassuring visit to have. So I try to tell patients if you've had a significant illness or injury or 3 to 4 months, you should have some shedding. So that can also help them realize, okay, this is going to come back. Maybe I don't need that acute visit. But if you start noticing burning, itching of the scalp, or excess hair loss, like in that regard, I would get in sooner than later.
Yeah. Again, call Dr. Jensen. Say this is happening to me. As you're hearing some of these things, and I'm hoping again you share this with others that didn't get a chance to watch it live. There are a couple of phone numbers for you, and she can get you in. You're not having to wait 6, 7, 8 months, 12 months. She can get you in. She opened her practice in Chesterfield a handful of months ago. The one in Festus has been there for a long time. What, 14 years?
14 years.
636-933-7600 for the Festus location. 636-237-0030 for Chesterfield. Again, the website, regionaldermatology.com. But again, be referred early. Get to Dr. Jensen so that you can, get on that program early. And then continuing to monitor it. You do serial photography?
I do less photography, more blood work. We
work,
just
okay.
really do it clinically by description in the chart. Yeah.
Okay, so we have a question that came in from Kim. What is the best way to address the hair above our lips that seems to increase after menopause? I've heard shaving is not a good idea. Oh, good question.
Well, I mean, shaving just basically brings it down to the skin level, so then you have to deal with kind of that stubble. If it's dark hair on lighter skin, so better to do it towards the fall, winter months, you can do laser hair removal, which is one of the options I've opted for.
Okay.
You can wax. Some people use these. They're like little blades, kind of a microblading.
Yes.
They'll do that in some salons or spas. Those are the treatments typically.
Well, and I was going to ask about dermaplaning. Do you do that?
Personally, I don't do
No.
that in my office. It's usually more of an aesthetic,
thing. Yeah.
Right, right.
What are your thoughts on that? Is that
I think that can be helpful. It's really just like a turnover of skin cells.
Right.
And so, yeah, it's really kind of not that much different than shaving.
I love dermaplaning.
Yeah.
It also makes your makeup look incredible.
Right.
It gets off the dead skin and then those
Right.
little hairs. But I don't know. What I always want to know is once you started, is it something that you're going to have to do on a regular basis? Is it creating more?
Great question. No, I don't think it's creating
Okay.
more hair. Yeah. I think that's one of those, myths. Yeah. That
It is crazy. I remember my aunt talking about this a long, long time ago, and she said something about her son coming in, and she was, I don't know if she was actually using a razor, and he was like, "What are you doing?" And she's like, "Oh, honey, leave me alone. This is what happens as you get older. This is what you women have coming for you."
Right.
So good question, by the way, Kim. Thank you so much. And again, keep the questions coming in even after the show wraps up, because Dr. Jensen does an amazing job of answering any questions for you. So there are a lot of things that can be done. Don't feel like you're alone. As Demetra just said,
Correct.
she's gone through it. She's telling her story to help others. For the people who are scared to hear about laser or different therapies, can you calm them down? You've got low-level laser therapy sometimes that people think of. Is that a good thing? Do you think it's beneficial?
Actually, some people do this red light therapy that they can do at home. It's like a brush or even like a helmet. It's the same things you see for facial rejuvenation. So those are options that you can easily do at home.
Do they work?
I don't know if the data's all there.
Yeah, they are that.
Yeah, I think there's probably more data in the red light therapy for muscle rejuvenation, like after a heavy workout, those kind of things. It's supposed to stimulate the mitochondria, some of the power like cells of the body. But I don't know. I don't know that we have
More
the answer
research
for that.
needed.
Right.
Let's put it in that category.
And they're not cheap. They are a little expensive. So it's something I tell people that's the biggest risk is the cost. You know?
Well, okay, then let me ask about shampoos and conditioners that people use.
Right.
There's so much branding and marketing of, that this will help to grow the hair back.
Right.
This will make your hair be thicker. Is it all a marketing ploy, or is there any out there that you really, as a doctor, would say, here we go, use this?
I really don't. I kind of also leave that up to their hairdresser, their stylist. And so I feel as far as the treatment goes, it's something you wash in, rinse out, right? So I'd rather have something that's left on the scalp. So we often use that, the compounding of that minoxidil or Rogaine. We'll have it made up in a pharmacy that kind of mixes it up, kind of old-fashioned, and brings a few different items together. And that's left on the scalp. It's not sticky, tacky. It's just a solution, lightweight.
Because I know it's probably frustrating for a lot of you. You sit there and go, oh my gosh, there's aisles and aisles and aisles of, does this work? This says it works, but again, all these things that are allowed out there from the FDA that they allow to be in branding, and that's whether you believe it or not.
Yeah.
And I hate the people are having to spend so much money and they come back and go, well, that didn't work. This didn't work. This shampoo, this pomade, this thing, this is all supposed to help me, but it didn't. And sometimes it could be doing more harm than good.
Yeah, and there's supplements out there too. There's some of these branded supplements. Nutrafol is one of the big names I hear.
That was my last question before we wrapped up. Do you know any?
I think it can be helpful. I think it's very expensive for some patients to take on, and like the minoxidil is like $10 a month, where the Nutrafol can be $70 or up. You know, so it gets to be up there. But
so I would tell you to opt for the $10.
Yeah.
Let's try to save you money. And again, go to someone that is there to help you from a professional level. Thank you for telling your story. She said she was a little nervous when she first came in, but see? It's like talking to an old friend. Right?
Oh, you're amazing.
Oh, no, you are. It's all about you telling your story. I feel blessed with whoever sits in these chairs. One final time, the location, the phone number, the website of where you can go to have some help and assistance for anything that you need in the dermatology world. There you go. Regional Dermatology West in Chesterfield, Regional Dermatology South in Festus. Again, you can go to the website or call. I've had a lot of wonderful people that have gone in to see Dr. Jensen already. Thank you, by the way, for supporting her. She's wonderful, and that's I love the fact that everyone's had a great experience so far. So Regional Dermatology's website we'll put on the screen as well, and those phone numbers for you to get more information, regionaldermatology.com. Thank you. And when do you, so are your girls just starting college, or what? How old are
they'll
they?
be starting in two weeks.
Both going to college?
Both going to college.
Oh, my goodness.
Yeah.
Is that hard for mom?
Yeah, we'll have another segment about that. And where's the tissues? We'll need the tissues
Right
out.
here.
Lots
They're
of
always
them.
right here on set waiting for you. I bet you that's hard. But are they excited?
They're very excited
Okay,
and
good.
nervous too. I think it's a mixed emotion, you know.
Sure.
Changes,
I remember.
Yeah, changes a lot.
Are they in a dorm or?
Both in a dorm,
Okay.
both going different ways. One's in Indiana, one's going to San Diego. So
Oh, wow.
split up, yeah. Yeah.
Well, girls, I wish you the best. I wish I would have met them before they head
Yeah,
off. But yes, I know this is a hard time for a lot of parents. Some parents are like, hey, I'm empty nester. I've been looking forward to this. Others, it's like first day of kindergarten. We'll be seeing all those pictures pop up. Before they head off, will you have a little picture of them of first day of school?
Yes, for
First
sure.
day of college. Demetra, it was a pleasure meeting you. Thank you for coming in.
Thank you.
And everybody,
Likewise.
thank you, by the way, for bouncing back and forth to both of our shows. We'll be sure to take and put some stories and reels out there just in case you are confused and what happened. We had Russell Butler, dancing UPS man. Wasn't he awesome?
He was great.
Did you know about him before today?
I'd seen him maybe from your show.
Did you know about him?
No.
Spread the word because I love what he's come from and where he's going in life. Yeah, he's just a doll. And every day you'll smile because of the dancing that he does, just to bring a little bit more happiness and positivity to the world, which is what we need more of. One final break, and I'm going to let you choose. Do you feel 100 days to freedom from depression or shame or anger?
Nope, 100 Days to Freedom. No.
From depression?
Yes,
Depression was probably your hardest one? Okay, we're going to do depression. That's the one I'm feeling as well. That's how we're going to wrap up the show when we return.
The world needs to be more positive.
Yep.
You know, the world, and I'm spreading positivity with my air fresheners. So,
You and I both,
yes.
sir.
Sadly, I wasn't aware of the Monica Adams show until recently, and was I missing out?
I'm definitely going to turn this on in the mornings on our TV.
She's helping people to understand their value. She's helping women to transform their lives.
From the minute that we walked in, I felt just really comfortable and at home here.
You are always a ray of sunshine and positivity.
Thank you for what you do. I love this whole thing that you're doing.
It's good news. It's great news. It's uplifting and empowering.
But you were engaged, and I love that. So thank you so much.
Well, again, I say it all the time. I feel blessed for all the people that are saying those incredible things about what we've been doing over the last year and a half. We're coming up on 400th show, and that'll be the last week of September. Still looking for a big celebration place. If you know somewhere that you would like for us to hold that 400th show, please let me know. Email me, info@TheRealMonicaAdams.com. I love where we have held 300, 200, 100. As we start to hit those milestones, a lot of eyes are on those shows, by the way, so that business will get a lot of attention. Let me know. We're going to choose, and then I'll make an announcement coming up probably a little bit later in this month of where that will be. We would love to see you. Big giveaways those days, and just a whole heck of a lot of fun. We do have a live broadcast coming up, by the way, on Thursday that I'd like to see you at. Adventure Unknown from 4:30 to 6. If you can be there live, that would be great. I'm being told there could be like 15 to 20 different giveaways that we're going to have, and that we're going to have Reed Lowe, former St. Louis Blue player. He'll be with me. Some different business owners that have become members of Adventure Unknown. They're all going to be there, and they're going to tell you why that is a community that's been waiting there for you. So 4:30 to 6, be there live if you can. If you can't, watch online, because I'll be doing some giveaways to those of you online as well. Okay, this is the one we chose, 100 Days to Freedom from Depression. And how funny, because it says dance, like Russell would tell you to do, play, and sing a little louder. Praise him with tambourine and dancing. Praise him with the stringed instruments and flute. This is Psalm 150, verse 4. So if everything in the Bible is there for a purpose, we should not overlook the significance of the many biblical references to music. Music's universal. It's cultural. The Bible talks about playing instruments before battle as part of celebrations in times of sadness. Sometimes music includes words. Other times it's just the instruments speaking to our soul. Music moves us. I know it does me. It brings emotions deep within us to the surface. And by doing so, we can experience healing. There are some researchers in Canada that found that listening to music increases good chemicals in the brain. While varying types of research continues to be conducted around depression and the brain, we cannot deny how music affects the brain. Sometimes when we're struggling with a sickness or ailment, we might struggle to find the words to describe what we're experiencing. But music can help draw out the words and the emotions we're experiencing. It can even lift the mood of the depressed. Sometimes music has the ability to communicate more effectively, and the people of the Bible actually knew this. Throughout the Bible, we find references to music, not only God's people playing and singing for him, but God actually celebrating us. So the next time depression begins to creep into life, consider putting on some music, worship music maybe. Listen, really listen. Hear the harmonies. Play your own tune. Move your body in an act of worshipful dancing. Experience the presence of God through music. Martha Graham said, "Dance is the hidden language of the soul." So today's prayer: Father, thank you for the example of different ways to express how we truly feel. When I cannot find the words, please remind me to listen to and sing songs of praise that will direct my heart to you. Amen to that. Music can help.
Oh, definitely.
Oh, definitely, she says, yes. Again, thank you to all of you. Thank you to Dr. Sara Jensen, to Demetra Begus, to Russell Butler, and of course to all of you, because without you watching and without our incredible sponsors, we wouldn't have this wonderful show that I believe is changing lives on a daily basis. Remember what we always say: go out, be anything you want to be in this world. Take care of yourself, by the way, today, because it's a one final day of hot weather. Greet somebody with a smile. Tell them something that lifts their spirit up, because that is how you spread kindness. Be kind, and God bless you all.